Hello, my name is Brittany. I'm the nurse midwife today, and I'm going to be performing your assessment. We're going to check your temporomandibular joint. We're going to check your cervical spine, your shoulders, your knees, and then your feet. Does that sound great?
Yeah,
Okay, to whom do I have the pleasure of assessing?
Charlie.
Great to meet you, Charlie.
Nice to meet you.
All right, so I'm going to be feeling around with my hands. Is that all right?
Yeah.
Awesome. So let's get started. We always begin every assessment by inspection. So I'm going to step back a bit, and I'm looking at Mr. Charlie's face. It does appear that the sternomastoid muscle, I'm so sorry, that the temporomandibular joint area and these muscles here appear nice and symmetrical. I don't see any bulging or hypertrophy on either side or atrophy. I don't see any redness either. So I'm going to go ahead and put my hands on your face, okay? So can you please open and close your jaw? Perfect. So I'm feeling for any crunching, popping, clicking, any pain whenever you open and close your jaw?
No.
Perfect. I don't feel any of that I described, the popping, clicking, or crunching. He denies pain. Perfect. So I'm going to have you now open your jaw, stick out your lower jaw. Okay, now can you move it side to side? Perfect. So I see great full range of motion with no limitations. So now can you do that against my resistance, side to side? Now push your jaw out. Excellent. So we do appear normal there. So next I want to assess the sternomastoid muscle. So I'm gonna just look at the neck muscles here. They don't appear to be bulging on either side, hypertrophied. No swelling that I can see or redness. The color is nice and appropriate to the rest of his skin. I don't see any lumps or nodules. So I'm gonna go ahead and palpate. I'm gonna feel each side. Any tenderness when I palpate, when I touch here?
No.
Okay, perfect. So the muscles do appear bilaterally symmetrical in size. No lumps, lesions, or tenderness. So now I'm going to assess the range of motion of the cervical spine. So if you can please bring your chin to your chest. Now bring your chin to the ceiling. Beautiful. Okay. Now against my resistance, can you bring your chin to your chest? Excellent. Great strength here. Okay. Now bring your chin to the ceiling. Okay. Now chin to chest. Excellent. So against my resistance, we have great full range of motion. I didn't feel any weakness, appropriate in strength, so that is a great positive sign. So next I'm going to inspect the anterior shoulders while I'm here. So I do see that they look symmetrical in size. I don't see any overt lumps, lesions, and I don't see any redness. So I'm going to go ahead and palpate, okay? So I'm palpating the shoulder here, and any tenderness, pain? No? Okay, perfect. So they feel appropriate in size, no hypertrophy, atrophy. I don't see any deformities here. That's great. I'm going to go ahead and assess him posteriorly. So I'm going to move on to the back here. And I'm going to continue on with the shoulder. So I'm inspecting both shoulders. They look symmetrical. The scapula do appear perpendicular to the spine. The spine is nice and erect, and the head is held up erect with minimal effort. And like I said, the spine is nice and straight. The shoulders appear to be even and symmetrical in size bilaterally. So I'm going to palpate the posterior shoulders. Same thing. Tell me if you feel any pain, tenderness. I don't feel any crepitus. Okay, perfect. So we're going to test your range of motion for the shoulders. So can you actually bring your hands behind your head, kind of like you're relaxing in a pool? Excellent. Effortless. Great range of motion. Bring them down. And then now I'm going to ask you to shrug your shoulders against my resistance. So if you can bring your shoulders up. Excellent. So I can feel appropriate strength in bilateral muscles. So great effort there. So I'm gonna continue on. If you can stand up, please. Okay, and if you can walk this way and then face, this back wall, perfect. So I'm gonna continue on with my cervical spine assessment. I've already mentioned how the spine is nice and aligned. The scapula appear to be symmetrical and bilaterally in about the same area. I don't see any deformities, any swaying of the spine on either way. I don't see any obvious scoliosis, no kyphosis or lordosis. We have that natural sway of the lower back. I'm seeing that the iliac crests are about at the same level on each side, and the gluteal folds also appear to be at the same site on each leg. The glute muscles also appear to be symmetrical in size, which are all good signs that our hips are nice and aligned. So to continue on, I've now inspected all of the back. I'm going to palpate the trapezius muscle. And I'm just making sure it's nice and firm. Please tell me if you feel any pain or tenderness. But the muscle feels nice and firm. And I'm gonna now go to the paravertebral muscle here. All these muscles on the side of the spine. And I don't feel any lumps, bumps, masses, or lesions. And like I said, I don't see any deformities. So I'm gonna move down to the spinous process. And they all feel very aligned. I don't feel any deformed or misaligned or any pain or tenderness. No, okay, great. So we look beautiful there, nice and normal. The arms are nice and relaxed on either side, and everything looks appropriate. So now I've inspected your hips. I'm going to palpate the hips. So please tell me if you feel any pain or tenderness. So over here, I don't see any redness, swelling. I've already mentioned that the hips do look nice and aligned with the iliac crest at the same level on each side of the hips. Okay, so now I'm gonna test the range of motion of the cervical spine. So if you can please bend forward and try to touch your toes. So this gives me a great opportunity to inspect the spine. It appears nice and straight, and I see that the lower part of his back, instead of having a little concave in like it naturally should have, it makes a nice C shape, which is, it's rounded and it's appropriate. So I don't see any scoliosis again. The spine is nice and straight. So we look great there, great range of motion. All right, so if you can stand up, please. And then let's have a seat back in the chair, if you don't mind. Perfect. So we've assessed the shoulders, and we're gonna move down. Now that we know all this has great muscle strength and range of motion, we're going to move down to the elbows. So I'm first gonna inspect them, and I do see that the muscles in the arms, starting from the shoulders down to the hands, look bilaterally symmetrical. I don't see any overt masses, lesions, lumps, bumps, no redness, and I don't see any obvious inflammation. But I'm going to palpate now the elbow here. So on either side of, with my thumb and my fingers here, I'm going to go on the epicondyle of the humerus on the medial and lateral aspect. I'm just gonna palpate at the joint, feeling for any bogginess, any tenderness when I feel or pain. Okay. So can you please extend your arm out? Okay, now can you flex it in? Perfect. Okay, now let me inspect the other side. I'm gonna palpate, same thing, on either side of the epicondyle, the lateral and medial aspect. And I'm assessing the joint here. And now can you please bend your arm? Bend your arm, please. And now extend it. Perfect. So I'm assessing that he has full range of motion, which is beautiful. Now against my resistance, can you try to push up? Okay, now push back down. Excellent, very strong arms there. And then can you please do the same push up against my resistance? Wow, it's about to lift me up off the ground. Okay, now extend back down. Excellent job, I can see that. You have great muscular strength. So I'm gonna move down to your wrist here. So I'm just gonna first inspect the dorsal and then the palmar aspect of his hands. So I can see that they look symmetrical, no obvious deformities in the hands or the bones. I see that the bones of the hands are nice and aligned with the forearm bilaterally, and that is symmetrical. So that's wonderful. Can you please turn your hands over? Same thing, I don't see any abnormalities, appropriate in color, nice and pink. So can you turn over again? So I'm gonna put my two thumbs here, and this is the metacarpal interphalangeal joints that I'm assessing. So I'm actually, I'm starting here first at the wrist, and then I'm going to these joints individually. At every finger, I'm feeling in between any pain or tenderness.
No.
I don't feel any lumps, lesions, masses. So I'm moving down to the knuckles here. Perfect. And then I'm going to the interphalangeal joints. Moving down every finger, assuring that I don't see or feel any lumps, bumps. I don't feel any bogginess or excessive fluid at the joints. So that is a great and positive sign. Perfect. So I'm going to move on to this hand. Beautiful. So the metacarpal interphalangeal joints here, just assessing them one at a time. Perfect. Any pain or tenderness on this side? Beautiful. Okay. So I want to assess your range of motion. You have great strength everywhere else in your muscles. But I'm going to ask you to please flip this up. Now if you can try to just try to bring your hand up against my resistance. Okay. Great muscular strength. Okay, and let's go again on this hand. Stabilizing the joint. So ideally we would have a table. And then can you please, yeah, excellent. Great range of motion there. Great muscular strength. Bilaterally is the same. So we're looking great there. But realistically, we would love to have a table there. So against a flat surface, you would place his arm and then kind of show me that strength. But I was able to do that just as we had it. So we look great there. So we've already assessed the hips, and we can see that he can bend forward. And then I also assessed a lot of his cervical spine with him just walking. I can see that he walked effortlessly, holding up his head above his spinal cord with minimal effort. And it didn't appear that he had any difficulties in his gait, so that was wonderful. We're gonna move on to the knees now. So I'm gonna maybe back this up a bit so we can get a better view in the camera. Thank you so much. So I'm gonna put my thumbs here, and I'm assessing the muscular strength above the patella. So I do see that the muscles on each side do look symmetrical in size bilaterally. I don't see any lumps, bumps, lesions, any masses, any abnormalities that are obvious to me. No redness. The color looks appropriate and matches the rest of his skin color, so that's great. Now I'm going to assess the tibial femoral joint here. So I'm feeling for any pain or tenderness.
No.
Okay, let me feel on this side. Excellent. So now I'm going to test your range of motion. So can you please extend your leg out? Now bend your knee. Okay, now against my resistance. Oh yeah, there you go, very strong. Now bend it again. Excellent. Okay, now let's do the same on the other side. Can you extend your leg out? Great job. Now back in. Awesome. Okay. Show me how strong you are. Yep. Okay, back down. Oh, awesome. Okay, you're very strong. You're doing a great job. So we're gonna go ahead and move down to my patient's feet here. Let's hope that the camera can see. That's great. Okay. So here, I'm going on the inner and outer, the medial and lateral aspect of the malleolus. And I'm just, again, feeling the joints for any bogginess or tenderness that you may feel. Do you feel any pain or tenderness? No. Okay, great. The ankles do appear symmetrical in size. I do see that the toes are aligned forward and nice and even with the bone of the leg. So I'm going to go to the metatarsal interphalangeal joints. So just as I palpated the fingers, the joints align with each finger, I'm palpating alongside each toe. And I don't feel any lumps, lesions, or masses, which is great. And now I'm moving down to the joints in between each toe. And you don't want to miss anyone. Any pain or tenderness? Excellent. No. All right, so can I see the other foot? So I'm doing just the same here. Excellent. So the metatarsal interphalangeal joints here is where I'm palpating. And then I'm moving down to the interphalangeal joints of the toes. Excellent, excellent. Okay, so next we want to do range of motion. So can you bring your toes up to the ceiling? Let's make sure the camera can see. Toes up to the ceiling, now down on the gas. Perfect, now up to the ceiling again, now down on the gas. Wow, super strong. Well, it's been such a pleasure assessing you, sir. Wonderful, and I hope to see you in clinic again soon.
Thank you.
Awesome.